Okay. In behavioral approaches, so this theory is also known as the connected theories. Connected theories. So based on the behavioral approaches, based on the theories of behavioral, or depending on the behavioral theories, we have some therapeutical techniques, procedures. One is behavioral therapy, or you can say cognitive behavior therapy. Okay, this cognitive behavior therapy is totally depending on the B.F. Skinner's operant conditioning theory. Operant conditioning theory. In the cognitive therapy or cognitive behavioral therapy, cognition means thought process. Okay, so the thought process, whatever their understanding, whatever the understanding of the individuals, whatever their perception, depending on their understanding and the perception only, their activities, their behavior, their attitudes. That is the reason cognitive component, affective component, and psychoanalytical component. You might have heard about these components. One is cognitive component, second is third is the psycho component, or you can say cognitive component of behavior. So in this behavioral therapy, we will analyze their behavior, behavioral patterns. Behavioral patterns means how their outward or inward behavioral procedures. Okay. So in cognitive behavioral therapy, CBT, briefly you can tell them it is a brief CBT, cognitive behavioral therapy. So cognition means thought process. Based on their thought process, depending on their level of understanding, so the person's behavior. Okay, behavioral therapy is based on the principles and the procedures of this behavioral theories. For example, if the maladaptive behavior or abnormal behavior, if you find in any case, so we need to modify that behavior. So the behavioral therapy deals with the client's current problem and the factors influencing them. So the current problem, one important aspect we need to identify. Second thing is, what are the reasons of his behavior? What are the reasons of his abnormal or maladaptive behavior? These both things we have to understand. Then only it is easy to know the reasons of his behavior. With understanding of reasons of his or her behavior, it's not so easy to provide the counseling. Counseling, that is our role, our responsibility to identify the reason maladaptive behavior.
Your voice not clear, sir. It's breaking.
Voice is not clear, sir.
Not able to hear anything, sir.
Delinked, sir.
Sir, your audio got disconnected, sir. You are on mute.
Hello? Hello?
Yes, sir. Sir's voice is not good.
The
Yeah,
problem is I tried his number. The sir
yeah.
number is also not something wrong. One digit extra. Mhm. Wrongly given number.
Oh.
Am I audible now?
Yes, sir.
Yes, sir.
Okay. Okay. So here in the behavior
Voice is very low, sir. Excuse me.
yeah,
Sir, your voice is very low, sir.
price is very low. Is it okay now?
Yes, sir.
Am I audible
Yes, sir.
now?
Yes, sir. It is clear.
Yes. So in this cognitive behavior therapy, CBT, behavioral therapy, or you can say cognitive therapy or cognitive behavioral therapy. Why it is called as cognitive behavioral therapy means, so cognition leads affective domain. Cognitive domain, the impact of cognitive domain is on the affective domain. So both of these cognitive domain as well as affective domain, based on these both domains, the behavior of any individual. So CBT, cognitive behavioral therapy, the focus of the cognitive behavioral therapy is, first of all, assessing the overt and the covert behavior of the person or individual. So in order to assess the covert and it is internal and external behavior of the person, what to do? First of all, we need to identify the various reasons of his behavior. For example, if any behavior is child, so here there are so many other aspects we need to discuss, we need to check, we need to verify, and we need to find out the reasons of his behavior. Maybe the family environment, maybe workplace environment, maybe the school environment, organizational environment. So is there any issues related to these various environment that we check first? Okay, in cognitive behavioral therapy, why his understanding capabilities are like that, why his behavior is like that. So in order to modify his behavior, in order to reduce his abnormal issues, so we need to check his various factors related to the individual as well as the client. So here, these are one important aspect. We need to check various reasons of his behavior. Number two, goals of the behavioristic therapy. Behavioristic therapy or behavioral therapy means cognitive behavioral therapy or behavioral therapy. There are some goals of behavioral therapy. First goal is that eliminating the unwanted behaviors, reducing the unwanted behaviors. For example, if the child is behaving in a different way, for example, restlessness is the one unwanted behavior, or tantrums or other unwanted behavior. Restlessness, okay, tantrums and aggressive behavior. These are all some sort of unwanted behavior. So if you want to reduce this or eliminating these unwanted behaviors, so you need to analyze various situations. For example, time, place, person. Time means this type of unwanted, this type of abnormal behavior, the child or the individual shows in the morning time or afternoon time or evening time. Some children, their abnormal behavior or unwanted behavior will be only in the social gatherings. They will be normal in home environment. Their behavior is normal in the school environment. Whereas the same child, the same individual, the same client, he will show some type of abnormal behavior in the group activities or social environment, social gatherings. So here we have to analyze his behavior or behavioral pattern in various conditions, various situations, various environmental conditions. Okay, that means time, whether it is morning, afternoon, evening, or any time related to his environment. Number one. Number two, place. The behavior in which place, either it is home environment or workplace or any other place, or you can say it's a ground or it is a maybe park, play area. So this type of behavior, this type of abnormal behavior, this type of unwanted behavior, the child shows in a different places. That also we need to analyze. Third one is in presence of mother, in presence of grandparents, in presence of some other friends or relatives, if he shows that behavior, that unwanted behavior, that also we have to check. So slowly, for example, he is not behaving properly, some type of abnormal behavior, how to reduce these unwanted behaviors. That is the one goal of behavioral therapy. Number one. So eliminating the unwanted behaviors or reducing the unwanted behaviors. For example, in some cases, attention seeking behaviors. This is some type of behaviors or unwanted behaviors among the children. Attention seeking behavior means some children, those are in the pre-childhood stage or infant stage, they always want their parents' attention on their own thing self. For example, parents are discussing some issues with other his colleagues or guests. These children, they won't allow the parents to discuss with the other fellow beings. So in order to seek their attention, they will show some sort of unwanted behavior. That behavior is known as the attention seeking behavior. So if it is the unwanted, if you find it is unwanted behavior, problematic behavior, we need to reduce their, eliminating their behaviors or reducing their behaviors. For example, in this case of attention seeking behavior, if you neglect, if you overlook their behavior, slowly they will understand, okay, even if I show this type of behavior, the mother or the parent is not focusing on me. Slowly, what happens? They slowly stop their behavior of attention seeking from the parents. Okay, so eliminating the unwanted behaviors, one part. Promoting desired behaviors, we need to reduce their unwanted behaviors, and we have to promote the wanted behaviors, desired behaviors, normal behaviors. For example, restlessness is the unwanted behavior. In order to reduce, in order to eliminating the restlessness, we have to give some activities which increases their attention, which improves their attention. Maybe drawing activities, painting activities, some sort of activity to sorting the things. So here, actually, their restlessness, if you find any restlessness or not sit at one place, if this is the behavior issue, this is unwanted behavior. So reducing the restlessness and improving the sitting tolerance. So first goal is reducing or deleting or eliminating the unwanted behavior. Second one is, second goal of behavioral therapy is improving their desired behavior, promoting the desired behaviors, wanted behaviors. So just an example is given. I already given one example. So if you want to reduce the restlessness, what to do? We need to improve the sitting tolerance. In order to improve the sitting tolerance, we have to give some sort of activities which increases the span of attention, increases the sitting tolerance. For example, initially in the first day, when you start this therapy, you have to give 5 minutes sitting tolerance, 5 minutes span of sitting tolerance by giving some activities of sitting tolerance. If he involved in that activity by sitting in the same place for 5 minutes, after 3 days, we have to increase the span of attention from 5 to 7 minutes. That means you are reducing his abnormal behavior or unwanted behavior of restlessness, and you are promoting the desired behavior of sitting tolerance. Got it? First goal of behavioral therapy is eliminating the unwanted behavior. Second goal of behavioral therapy is the promoting the desired behavior. Third one is reducing unwanted emotional responses. Reducing unwanted emotional responses. Unwanted emotional response means, see, we know that emotions to be expressed in the right manner, the right person, in the right situation or the context. So if the unwanted emotional responses, unwanted emotional expressions are shown in a different way, so we need to reduce those unwanted emotional responses. For example, a client who fears snake might first imagine seeing a photo of it. So here, then some techniques are mentioned here in this unwanted emotional responses reduction. So here, for example, there are some systematic desensitization technique or ERP, exposed response pattern. Systematic desensitization means whatever the emotions systematically, stepwise, we have to reduce. That means reducing of unwanted emotional responses. Got it? So here in this behavioral approach, we know that theoretical approach already we learned in your previous year, first year. So in the behavioral approach of classical conditioning theory and operant conditioning theory also, one experiment already we know. So unconditional stimulus, unconditional response, conditional stimulus, conditional response. Okay, 3 levels of conditioning: before conditioning, conditioning, and after conditioning. We will provide some food to the animal. Along with the food, one type of unconditional stimulus. We will immediately after ringing the bell, we will provide the food. Okay, in first stage, without any condition, providing the food to the animal. That means unconditional stimulus. So for this unconditional stimulus, unconditional response. Then next level, providing food along with sound, bell sounds. So that is the conditional stimulus. So conditional response. The finally, no food, only bell. By hearing the voice, by hearing the noise of the bell, also the same type of response you will get from that animal. But that response is the conditional response. Initially unconditional stimuli, unconditional response, then mixing the food. Before providing the food, one type of unconditional or conditional stimulus first. Unconditional stimulus, unconditional response, then conditional stimulus, conditional response. That is the classical conditioning theory. Okay, in other that is connection theory, why it is known as connectionism. Connectionism means connecting the stimulus with the response. That is the reason these theories are known as the connecting theories. Connecting the stimulus to the response. Even the trial and error theory of Thorndike also, Edward L. Thorndike also. If the trials are more, automatically the errors will be reduced. The best example of trial and error theory is cursive copywriting. In the cursive copywriting, the first line of the page, the clear-cut writing will be given on the first line of the cursive copywriting. By copying that line, the first line, for example, if you write a sound mind in a sound body, that is the line, that is the sentence written on the first line of the cursive copywriting. By seeing that, by copying that, by observing that line, the child is supposed to write second, third, fourth, 5, and so on, all remaining lines in the cursive copywriting. In the first trial, when they write on the first line of the cursive copy page, so mistakes will be more, errors will be more in the first trial. Then in second trial, for example, six mistakes in the first trial. Second trial means number of trials increased from 1 to 2. Second trial, the errors will be decreased. Instead of 6 errors in the first line, maybe in the second line 4 errors only. Then in third line 3 errors. In the fourth line, fourth trial, only 2 errors. Finally, last trial means, for example, 10th trial. So the trial increases from first to 10. The errors are decreased from 6 to 0. So this is trial and error. After completion of his learning, if you say something verbally very good, that means if you say this type of stimulus, the response will be more. So that is a connection between the stimulus and response. Same way in the classical conditioning theory also, Ivan Pavlov's classical conditioning theory also. Based on the stimulus, as I mentioned, unconditional stimulus, unconditional response. Conditional stimulus, conditional response. So depending on the stimulus, response. So the connection between the stimulus and response. And in the operant conditioning theory, in the operant conditioning theory, here also one experiment, you know, the rat experiment or the pigeon experiment. Okay, then the animal gets some sort of positiveness. Means if they got food, so the that is reinforcement is positive. Automatically through the positive reinforcement, so that they tried it more. They tried to get the food in a different. Their efforts are more. So here positive reinforce in the operant conditioning theory of B.F. Skinner, reinforces plays a vital role. Both reinforces, like positive reinforce and the negative reinforce. Positive reinforcement means, for example, if the behavior is modified, so the abnormal behavior modifies as the normal behavior. The individual, the client, or the subject, or the child modify his abnormal behavior to normal behavior. We need to reinforce in a positive manner to strengthening his behavior, to continue his normal behavior. So if he or she modify his abnormal behavior to normal behavior, we need to reinforce in a positive way. By providing positive reinforcement, they will try to further modify their behavior. Okay. Then social learning theory. In social learning theory, by imitating the neighbors, by imitating the peer groups, by imitating the others in the society or in the group, they learn so many things. The individuals from their pre-childhood stage, this type of imitating from the peer group, this type of learning something from their neighbors, this type of learning something from their siblings or the other members in the society. They learn so many things. So as I mentioned in the previous class, learning is modification of behavior through training and experience. In learning, One important factor is changing the behavior, number one. Number two, learning is modifying the behavior. And learning also changes the performance. If the child is not performing perfectly in the previous class, by learning so many things, he will perform in a better manner. In learning, changing of behavior, in learning, changing of performance, learning, changing of his own internal and outer behavior, external behavior also. It is observable. See, even the social learning theory also, there are so many things, so many aspects. The child, the individual, learn from their neighbors, peers, and society. By imitating how to dress, by imitating how to speak, by imitating how to communicate, by imitating how to learn cultural aspects. These are all the things the individual, the child, the person learns from the society. Yeah. So in cognitive behavior theory, changing of disorders, some sort of disordered thoughts also. In cognitive behavior therapy, as I mentioned, one is changing the abnormal behavior, changing the unwanted behavior, then changing their cognition also, the thought process, changing the disordered thoughts, deviated thoughts. So again, the same thing. Thought process leads some sort of positive emotions or the negative. If you think in a positive way, automatically our emotions also in a positive, our attitudes in a positive, our aspirations in the positive. If you think, if you understand in a negative manner, that means cognition is in the negative way, automatically the impact of this negative cognition is on the emotions, that is affective domain. So the behavior. Even applied behavior analysis also, how the analyzing the behavior. In applied behavior analysis also, remedial behavior, so for example, any aggressive behavior. So if you analyze this type of behavior, applied behavior analysis, it is depending on the SR theory, I mean stimulus and response. The procedure generally manipulating the environment. For example, there are two important therapeutical procedures. One is changing the behavior of the person from his own side, from himself, from his own side. That is one aspect. Second is, if he or she is not in a position to change their behavior, what to do? Changing the environment. Internal therapies, external therapies, or you can say inside therapies and external therapies. Inside therapies means the therapy that provides to improve his insight of any person. That is inside therapy. In some cases, for example, if the IQ levels are very low, their cognitive levels are very low, how to change their insight is not so easy to change their insight from their own self. Why? Because their understanding capacity is very low. For example, before starting any psychological counseling, we will assess his IQ levels. Maybe if the IQ level is mild, moderate, or borderline, what happens? That means the person is a trainable person. You can train up the child. By training, you can provide some sort of learning aspect. As I mentioned, learning is training and experience. Through the training and experience only, so many things can be learned. In this case of mild and borderline case of IQ, providing train is possible. But whereas if the IQ levels are very low, like severe or profound type of intellectual aspects, so training is not possible. What to do? In that case, changing the environment, providing the environment to suit his behavior. As I mentioned, therapies are broadly two types. One is insight therapy, improving the insight of the person, understanding capabilities of the person, so that he will understand. If you provide proper train, he will understand. He know how to understand. He will learn things from the society, from the environment, from the therapists, from the parents. So he will modify his behavior. That is the therapy. The therapy is known as the insight therapy. Second type of therapy is the external therapy, changing the environment. So modifying the environment, manipulating the environment, so manipulating the client's environment. So the goal is to increase the adaptive behavior through reinforcing capacity, through the changing of the environment. So modifying the behavior is in two ways. One is improving his insight, understanding capacity, by providing some type of training. Second is changing the environment, manipulating the environment to modify his behavior. Okay, in this applied behavior analysis, we will analyze because this applied behavior analysis depending on the operant conditioning theory. So here we will provide some sort of reinforcers to modify his behavior. Positive reinforcement is to strengthening his behavior. Negative reinforcement is to reduce his abnormal behaviors. Okay, some techniques of the behavioral therapy. Classical conditioning theory, aversion therapy. This therapy is also known as the aversion therapy. For example, if for example to reduce the drug intake, if the case is substance abuse case, drug addict case, in order to stop taking that drug or any substance, using substance, one therapy, one technique is the technique name is aversion therapy or aversion technique. Okay, so what general in the psychiatric hospitals, as an inpatient, if he or she joined, so what one type of injection, one type of medicine they will use. After using that medicine, after using that injection, again, if that person, the client, takes any substance, what happens? He will vomit. So through his vomiting, by his vomiting, so he will understand some sort of dangerous to my life. Slowly, that aversion means avoiding that particular drug or substance is possible. That type of technique is known as the aversion therapy or aversion conditioning. These aversion therapy is based on the classical conditioning theory of Ivan Pavlov. Second is systematic desensitization. Systematic desensitization. Sensitization, desensitization, systematic desensitization. This systematic desensitization means that generally this type of systematic desensitization we apply to the cases of the phobia, child-related cases. Okay, so here in this systematic desensitization, reducing that fear, phobic conditions systematically. That is the reason systematic desensitization, and systematic desensitization. This is also one technique that is depending on the classical conditioning theory. Third one is the exposure, ERP, exposed response prevention. For OCD cases, obsessive compulsive disorder cases, this type of technique, the technique name is exposure. Briefly, you can say it's exposure, but ERP, exposed response prevention. Expose them to the, say, for example, if the obsessive thoughts means, the obsession means some sort of deviated thoughts, extra thoughts, obsessions. For example, repeated hand wash is the one type of OCD. Here, OCD means obsessions leads some sort of compulsory activities. That is the reason OCD. Here, compulsory activity is the repeated hand wash. The reason of that repeated hand wash is the obsessive thought. Obsessive thought means some dirty parts are there in their hands. That is the reason they will repeat the hand wash. If you want to reduce the number of hand washing instance, so we first of all we need to reduce that obsessive thought. Okay, so expose them to the dirty particles, expose them to the dirty environment, so that their anxiety will be high when they enter the polluted area. So ask them to be there for some time. For example, initially only for 5 minutes they'll be there with the dirty area. So immediately when they reach that place, their anxiety will be high. But in a first, when they enter into the very immediate when they enter into the time they enter into the place, immediately their anxiety will be high. But they are there for some time, like first minute, second minute, third minute, slowly, while the time is passing, slowly, and the time is passing slowly, the anxiety will be come down from 10 points to 9 points, 8 points, 6 points, so on. Expose them to the same environment. So that is the another technique of classical conditioning. Then in the operant conditioning also there are some techniques. One is reinforcement. The reinforcement will be both sides, that is positive reinforcement as well as the negative reinforcement. Third one is the generalization. So generalization means when they give some sort of unconditional stimulus, like ringing bell before providing the food. This type of bell, if you provide one type of sound, for that sound only, the response will get the response. Otherwise, different sounds if you provide, generalizing the sounds, so the response may not be expected. So here, discrimination, generalization, discrimination means different type of stimulus. So shaping means, for example, the communication, the problem of communication, we need to shaping their communication. In some case, misarticulation. That is one issue of child communication issues. So misarticulation. Instead of telling something, instead of pronouncing something, they will pronounce some other word. Okay. So shaping. Then token system, token economy or token system means after giving some time intervals, you will provide something. For example, we ask the child or the person to collect some coins or stamps, or you will provide some stamps and some collections after their modification of behavior. You will give some time for 1 week. If you modify this behavior, if you continue this type of normal behavior, I'll give this type of tokens. I'll give this type of stamps. I'll give this type of. That is token economy. That is also one important techniques based on the operant conditioning theory of the Skinner's. Then punishment. So here, positive reinforcement, negative reinforcement is only providing the things and reducing the things. But whereas punishment is something that punishes the child in a different manner. So these are all various techniques in the operant conditioning theory. As I mentioned, the classical conditioning theory, aversion therapy, then systematic desensitization, and exposure response technique or export. In the operant conditioning theory, reinforcement. Reinforcement means both sides, positive reinforcement as well as the negative reinforcement. then generalization, discrimination, shaping, token economy, and punishment. These are the techniques of the operant conditioning theory. In the social learning theory, or social and cognitive learning theory, modeling. Some sort of models you have to explain. Some sort of models you have to show. Some sort of models you need to give some sort of examples. So that modeling is also one technique in this behavioral approach. Especially this modeling is depending on the social learning theory, because so many things, so many aspects, the child, the person, the client learns by observing the social society, peers, or siblings, or the neighbors. So learning from the society is social learning. So modeling and even self-observation is also one technique of social and cognitive learning. In social learning theory, the things learned, the person learns something from the society, that is social learning. Cognitive learning means by observing, by seeing the others, by seeing the neighbors, by seeing the siblings, by seeing the members in the group, their understanding capabilities will be increased. That is social and cognitive learning theory. In all these techniques in this social learning theory and cognitive learning, even the classical conditioning, operant conditioning, we have to prioritizing the these behaviors. For example, in order to modify his behavior, which behavior you wanted to reduce first? For example, if the parent or the caregivers bring the child to you and his complaints are like that. For example, he is not sit at one place, he disturbing the others in the classroom, and tantrums. And the fourth one is the self-injurious behavior. If these are the four behavioral issues, if they bring to your notice in the counseling process, what to do? We have to give topmost priority to the self-injurious behavior first. Why? The other behaviors later on you can reduce, but self-injurious behavior is dangerous. That is the reason, in order to reduce the four, if they explain about the four behaviors of this child or any person, prioritizing the behavior, which behavior you need to start first, which behavior you need to modify first. In these four behaviors, like tantrums and disturbing others, restlessness, and self-injurious. In all these four behaviors, we have to give topmost priority to reduce the self-injurious behavior. Okay, so prioritizing the behavior, then analyzing the behavior, finding the reasons of this behavior, then finally your therapeutic approaches, techniques. This is the way you have to provide the counseling in these cases of behavioral issues. Any doubts on clarifications? In this CBT, as I mentioned, CBT means cognitive behavior therapy. Cognition, if you change the cognition, if we change the thought process of any individual slowly, that impact of changing their thought process, changing their perception, changing their understanding, that impact, the positive impact will be on their emotions. Okay. So if they change their perception, means if the negative perception that they have, if they change their negative perception from negative to positive, definitely that positive perception will give the positive impact on the positive emotions. The same way, negative understanding, if they have negative understanding, the impact of the negative understanding is there on the affected domain of negative emotions. Automatically, if the negative understanding is there, the negative understanding leads to negative attitudes. So their behavior, understanding, then emotion, then finally behavior. Their behavior is in a negative way because of their negative understanding, because of their negative attitude, because of their negative emotions. If these negative understanding, if you changes, modify this negative understanding to the positive side, slowly the positive impact of his understanding will be on his positive attitude and positive emotion. Slowly the behavior also in the positive way. So psychoanalytical approach of counseling, then behavioral approach of counseling we learn. In the next class, cognitive approach of their behavior, cognitive approach of counseling we will learn. Is it okay? Any doubt?
Thank you, sir.
Sir, how do we differentiate between SR theory of operant and classical?
I didn't get you. Pardon?
The difference, how do we differentiate the same SR theory of operant and classical conditioning?
How to
Stimulus response.
differentiate?
The stimulus response theory of operant and classical.
Stimulus response theory.
Yes, sir.
Please speak loudly.
I believe my mic is not well, sir. Stimulus response, the
ఎందుకు అట్లా
difference between
ఊసేస్తున్నావు
SR
అన్నం
theory.
అన్నం పచ్చసారి ఎందుకు అట్లా ఊసేస్తున్నావు ఎందుకు అలా ఊసేస్తున్నావు కొంచెం తింటున్నావు ఊసేస్తున్నావు కొంచెం తింటున్నావు ఊసేస్తున్నావు ఏంటది ఆ?
Sir, how to differentiate between SR theory and a neo-behavioristic theory of SR theory? That is
How to
classical
differentiate?
between SR theory and neo-behavioristic theory of SR theory. Classical and operant conditioning theory.
Classical and operant.
Operant.
So here classical conditioning, as I mentioned, classical conditioning theory is focusing on the stimulus.
And operant is also
Operant
focused-
conditioning theory is based on the response. Okay, again I'll repeat. So here in the classical conditioning theory, if the stimulus is the unconditional stimulus, unconditional response, even in our theory, in our experiment also, conditional stimulus, conditional response. Based on the stimulus, based on the stimuli, the response in the classical conditioning. Whereas in the operant conditioning theory of Skinner, so here some sort of activities in the experiment. If we do some sort of efforts, based on their efforts, based on their trials, based on their activities, depending on their activities, the positive reinforce, by giving the positive reinforces the response, no? If you positively respond the child, definitely the same type of behavior, it repeats, it's strengthening the behavior. That means based on the response, based on the reinforcement. For example, if he shows, for example, just an example, if the child shows unwanted behavior, the mother or the teacher provides some sort of training to the child to modify his behavior. Got it? If he modifies this behavior, if he shows the normal behavior, now we will provide the positive reinforcement. Positive reinforcement is the response. By giving that response, we are providing some sort of positive reinforces. So based on the response of the child, whether it is positive reinforced, whether it is a negative response, that means the vital role here is this operant conditioning theory is response, no?
Yes.
Clear?
Yes.
Still you have same doubt?
No, sir, it's clear, sir.
So response based on the response stimulus. That is the operant condition. In classical conditioning theory, stimulus is the main based on the stimulus, depending on the stimulus response. That is the stimulus and response. This classical conditioning theory also known as S-type theory. Why? Stimulus is vital part. Stimulus is the main role in this classical conditioning theory. That is the reason this theory is also known as the S-type theory. Whereas operant conditioning theory of Skinner is known as the R-type theory. Here response is made. By getting food is the response. The trials, the searching for food is the stimulus. Getting food is the response. Even that experiment also, rat tries to get food, no? In the experiment of the B.F. Skinner box, Skinner box experiment. In the Skinner box experiment, pigeon and even rat also, the efforts of the pigeon and the rat is the stimulus. By that efforts, if they got some quantity of food, by getting some minimum quantity of food, getting food is response here. Stimulus is efforts in the second theory of operant conditioning. Getting food is the response. In initial stage, in the first stage, only some minimum quantity of food they'll get. By getting a minimum quantity of food, what happens? The stimulus will be increased. The trials are increased. The efforts are increased. So response, depending on the response, the effort. Okay?
Okay, sir. Sir, one more question. Topography of mind, according to Sigmund Freud.
According to your voice is not audible, madam. Some disturbance from your side. This sound.
Sigmund Freud.
Sigmund Freud. Yeah, Sigmund Freud's
Topography of mind, according to
topography of mind. It is conscious, pre-conscious, and unconscious. Conscious means whatever you are aware of doing things. That is, it is consciously you are doing the things.
What is the difference between the unconscious statement given by Sigmund Freud and Carl Jung?
Sigmund Freud and
Carl Jung.
Carl Rogers.
Carl Rogers.
Carl Rogers are not given any topology. His theory is different.
Unconscious, and he also has done the.
No. Carl Rogers is the humanistic approach. He has not given any topology.
Unconscious by Carl Jung, sir.
You are talking about the Carl Rogers.
No, sir. Carl Jung.
It is Carl Jung, but here it is Carl Rogers.
Carl Rogers' theory is humanistic approach, humanistic theory.
No, I'm not.
Carl Rogers' theory and Abraham Maslow's theory almost are same. Abraham Maslow's theory is based on the hierarchy of needs.
Sir, she is saying about Carl Jung, sir.
Why don't we just proceed with the next lesson instead of comparing with the other psychologists?
That we will see in the next
We have the same topic from the textbook only. I'm asking, ma'am. We have got this unconscious mind in our assignment. If you don't mind, may ask the question which is related to the subject which is there in the textbook, apart from irrelevant questions people ask during the session.
I thought maybe it is you are trying to correlate the theories, ma'am. So that part I think we can do it later. Now, if we finish this topic syllabus, cognitive behavioral approach, maybe you will get some idea answers. Carl Jung is Jung's
But you are
theory
talking about
is
the Carl
different.
Jung.
That's different, no?
That is the personality theories, no?
Yeah. So that we cannot bring here. That's what I'm saying, madam. Please do understand.
Madam, Carl Jung, that is CRL Carl Jung, JUNG.
Yes, sir.
That is a personality theory, na, madam. That okay, we will discuss those theories also, madam. Sure.
Because our topic is interrelated. It is also they have
Yeah, of course,
finished,
of
they
course.
have started.
Yeah,
Sigmund
yes,
Freud
of
and
course.
Jung
This,
has started
that is
theory.
also personality theory. But here we are talking about the approaches, madam. It's
No, sir, when we
purely
are
the
dealing with the
approaches
client,
of the counseling approaches.
when we are dealing with the client, we have to certainly take the consideration
Yeah,
of the personality.
yeah,
That is
yeah,
the
yeah.
only point I have taken up this with you.
Okay,
Thank you,
okay.
sir.
We will discuss those things also. Okay,
Thank
if
you,
the
sir.
time permits. Okay, madam. Hello.
Yes, sir. Thank you, sir.
Okay. Thank you.
Thank you, sir.
Thank you, sir.